Hi, good morning, good afternoon, wherever you are. I'm Suhail Chughtai. I'm an orthopedic surgeon based in England. And today I've thought of sharing my work on developing solutions using AI, the generative AI, to assist my own practice and then my colleagues' practice. My motivation has been that in the modern age, we have so much technology available, and every profession should be helped by that. Medical profession where I am in, I believe that there are nifty technologies, and particularly telehealth and then generative AI, which can resolve many of the lags issues and can in fact improve the quality of healthcare. There is so much administrative burden on the doctors. Imagine that a doctor in the clinic seeing a patient now has to document in detail all the stages of the consultation. Now, that is where the doctor is lost in the way of communicating with the patient. The flow of communication, the continuity, the consistency, the emotional part is damaged, dented, interrupted by the medical record, by the adding of data into the medical record system. That requires doctor looking at the screen, then the patient. So patient doesn't get that doctor's full attention. And that is one thing which I try to solve in what work I have done, which I'm going to show you briefly today. There will be a detailed program coming up soon, but today I'm just going to share the introduction of what I have done to solve. It's my attempt, and I want your feedback on that. So this particular feature where a doctor-patient conversation gets recorded by a very highly sensitive artificial intelligence-powered system, and then that is converted into notes. Now, those notes can be generalized summary, templated summary like the history of present illness, the medical history, past history, treatment history. So while we are talking to patient, we can carry on the way we have a conversation, but the artificial intelligence will actually segregate that conversation into chapters. So the doctor doesn't have to uh, take course off course from the natural communication with the patient, like how you are and what you're feeling like. But all the words will be converted into the structured conversation to EMR note. So that's what I'm going to show you today. The second part is that before the consultation starts, I believe that there are so many medical records to look at, and there isn't enough time on most occasions to go through those records to be well informed before we see a patient. That is where artificial intelligence can sift through those medical records very quickly and can memorize them briefly for that session so that you can talk to the system, to the application, and ask that the key information like what has been the blood sugar like in the last the six readings. So it'll tabulate you all the six readings with dates instead of you digging for them. Or you can simply ask, has the blood sugar been controlled in the last 1 month because I'm going to operate next week. So that trend, that contextual searching is also possible because remember, the generative AI is conversational. There's natural language processing in most of the LLMs, which make it very special tool. So I want to show you that process briefly today. So the first process is let's start with the sequence that a patient comes to clinic waiting in the lounge, and that is where you are looking at the medical records of the patient. So before the patient comes in the clinic, you want to be well informed about that. So I'm going to share my screen, and then I'll take you through that. So hope you can see my screen now, and that's my cursor rolling on this screen. So the GDPR compliance mandates us to anonymize patients' information. So I'm just going to upload a file, and the system, the way I've designed it, that you cannot upload a file into the system unless you take the consent of a patient that I am uploading your medical records. If that's a PDF file, If that is a system you're already integrated with, there will be a button. You press the button and you're connected to the local electronic medical record system. But before that, you have to take consent of the patient that I'm going to look into your medical records. Now, this patient's name has already been anonymized, but I'm going to re-anonymize it so that you can see how this detail is hidden. In this example, remember it's a very brief talk today, I'm going to anonymize this patient's name to a different one. So this is the patient's original name in this instance. And I want to say that let's have this patient known as 373737. And then I can change the date of birth to anonymous one. The date of birth actually will appear as a year rather than date of birth in the anonymized notes. And then you can anonymize all the numbers with one click, email addresses. In this brief example, I'm just going to show you how this gets done. So as you proceed, these 31 pages in this short example, to save time for the demo, you see that the pages are getting uploaded to the LLM, getting OCR'd, and then getting down with the OCR'd data, which is anonymized now. The patient's name is this. So the system, what the large language model gets to see is this patient, not the patient here. And then you can proceed for the summarization. Now here we have 4 options. I can have a quick short summary if this is one type of document. For example, there are 3 or 4 radiology reports, or there's one complete detailed pain clinic report. So I can have it summarized. I can have a detailed summary. Let's go for this short summary and see how it presents it. So in this case, this report, this is a 31-page report summarized in this manner. One of my patients I anonymized, and it says that accident detail, and then initial actions taken by the patient, reported physical symptoms, reported psychological symptoms, clinical examination as I conducted on this patient with findings and the diagnosis. So this gives me a quick summary before going through all the pages. Now, if I go back to prompts pages and I say I want to talk to this document, I go to proceed, and I can say, look, did this patient have any accident? So I'm talking to the medical records, and it says, yes, the patient 3737. So remember, this patient was anonymized, was involved in a road traffic accident on September 16, 2023, front seat passenger, stationary Vauxhall Corsa, and in Chigwell near North London, where the white transit van traveling at 40 miles hit the car. And then I want to know more, was the patient wearing seatbelt? Seatbelt. According to the report on page 5, the patient was wearing a seatbelt at the time of accident. You can in fact view that where did this information come from? So yes, the patient was wearing a seatbelt, as you can see here. He was wearing a seatbelt. And then you can ask more questions that what physical injuries did this patient sustain? So I'm now talking to the medical record. It has memorized temporarily in this session, and it's giving me the answers. Neck pain diagnosed as cervical muscular ligament strain. So it's giving me a brief introduction of what the neck pain was due to. And that is, again, it is not taking this information from anywhere outside, because here the large language model is confined, has a boundary to work within the information we provide. So the chances of hallucination are absolutely minimum in this regard. There isn't any information it is taking or comparing it with at this point. So same way, you can always analyze where is this information coming from. For example, left ankle pain mentioned here was taken from page 24. Here and here, page 24. So it cites all the references. Then if you want to export this page, let's say now you want to export this as a note of this clinic. You can export, and before you export, you can say okay, and then now you have the option of going to a particular set and copying and pasting that reference here. For example, I want to use this reference and paste it here, for instance. Let me go to any particular page which I want to save as a reference. So I can just either take a screenshot of that part, that information which is relevant, and save that part, and then just press Control V to save it as a record. Or I can save a whole page. For example, here I can save this whole page and then paste that page by Control V, which is paste command here. And then I can now download, or I can print. If I print, it gets printed like that. If I download, I have options, PDF and docs file. For example, PDF. So whole chat is downloaded, and this can go back into the EMR as today's consultation discussion. So this is one brief example I've shown you. And by the way, if I go back on this and back to prompt page and back on this, I have the option to delete whatever I uploaded. So that is different from the commercial large language models where we cannot delete the file. Let's see if I save it. I can view that file, and for same day, I can do a reanalysis and talk to that file again. I can open that file once again, or I can delete it. If I open that file once again, I can still communicate with the medical records and take more information. Or I can delete. If I don't delete, it'll be automatically deleted in certain limit of time, which software configures it 2 weeks, but we advise that doctors can delete them straight away. So what they're keeping is the anonymized model, not the model that we uploaded. So there's no patient information saved on the system because we have already anonymized it. So that's important. And let's see if we delete that part, it gets deleted immediately. So that is one way of doing deep analysis of medical records. In this short time today, there are other features like if you upload multiple records, multiple research papers, you can have a deeper analysis of those multiple research papers. Maybe I should do briefly one thing. I can upload 2 or 3 records here, for example, 3 files, and show you that quickly, that how we analyze multiple sets of records. So here the 79 pages from these 3 files are being uploaded to the NHS digital approved server, which is compliant with the GDPR. And then if we had anonymized, in this example, I've already anonymized the files, but if we had anonymized, then the model coming back to the text information coming back to the large language model for analysis is already anonymized. So there's no kind of giving out information of the patient's record. So if I start doing deep analysis of these 3 documents, and I want to say that what has been the type of what types. Let me see if it talks to me, because right now my mic is being shared on the stream and live streaming. It may not listen to me, but I'll try. Can you find out if these 3 reports have common accident or not? Yes, it listened to me. Certainly the mic is shared. So now it says, based on the provided medical reports, patient 005, the patient involved in a bus passenger, whereas the patient 004 had a road traffic accident as a driver, whereas the patient 006 was a roadside cyclist. So it has analyzed to some extent. Then you can say, please give me the list of physical injuries sustained in this set of accidents, one by one for each patient. So now it's going through the set of records and summarizing and comparing those records. I can go visit any page and see that how verified is that. And remember, the information we provided this, it's the LLM is only looking at that. It's not looking right, left, up, and down. The only information available to LLM at this point is this particular information. So let's go further and talk about it and say, has there been any psychological injury in this accident? So yes, it says that patient 005 had these psychological injuries, then patient 004 had some other, and so forth. Let's go a little more subjective now, saying what has been the most serious injury out of all these accidents which took the longest to recover? So that's a deep analysis, and it will take us time to reach that point. But now it says that the longest injury has been lumbar muscular ligamentous strain, 5 months from the examining date of examination, which means that it projected to finish or recover by March 2025. So this is it has already calculated the date of accident, the date of examination, and then the date of recovery, and it is quite a calculative process, which has taken 2 or 3 seconds, whereas a doctor will take maybe 10 minutes to finish this job. One more question we ask. Can you also help me understand what has been the most serious of these accidents? I mean, based on the speed of the vehicle. So it picked up that patients appears to be most serious. Now it's giving opinion. The car differential was 24 kilometers per hour when a car traveling approximately 25 miles an hour collided with it. So that's a speed differential. So one car of 20 at 24, one car at 25. So on the base of that, the speed differential was calculated. One more question before we go away from here. Can you confirm whether any of these patients were given physiotherapy as treatment? So yes, it confirmed that according to the provided text, remember, it's not hallucinating, it's not giving opinion, it's giving information. Patient 004 received physiotherapy treatment sourced by insurance company on 6 to 7 occasions, and then 006 and 005, and so forth. You can have a chat with this set of notes as much as you want. So this is what we're doing while the patient is waiting outside. And let's now bring the patient in the room and start talking. So when the patient comes in the room, you can have 2 options. You can have doctor-patient conversation being transcribed live by turning on the button on the mobile phone, which you have. Let's say if you have a device which is given to you by the hospital, which is connected to the hospital EMR, or it can be your own mobile phone if that's your own clinical practice. That software can run on mobile phone in a mobile responsive way. So again, I have taken the consent of the patient for recording the consultation. By the way, this audio which is being provided, which is being taken, the live audio is not going to be recorded. It's going to be transcribed in real time, and the moment the transcription finishes, the audio file is removed. So there's no recording as such placed on a server in the hardcore manner and saved with a name. Whereas the recording you upload is deletable immediately by yourself, or it will take 15 days to delete. You can program that as well. So here we start. Let me start some consultation note after having seen a patient. So I have seen Samantha Williams today, who is 50 years of age and has been complaining of right knee pain for the last 2 weeks. She had a stumble at a local superstore when she developed this pain, and despite uh, taking some paracetamol over the last 2 weeks, the pain has persisted. The pain gets aggravated by uh, walking and bending the knee, while the pain gets better by resting or applying ice. Can you close the door, please? And Yeah, please close the door. Thank you. So, this is now where the patient has right knee pain and the patient is taking paracetamol but not getting better. She noticed swelling on the knee. The swelling was moderate initially, and now it has become more prominent, according to her. It also feels warmer when she touches the knee. She doesn't have a history of past knee pains and has never had any trauma to the knee as much as she can recall. There's no family history of joint pains, except her father had some back pain um, during the later years of his life. Um, she does not recall any hospital admission in the last 10 years and has not had any operation as well. There's no allergy known to her, as she says. Uh, on examination, on general examination, she is about 70 kg and 5 feet 4 inches tall. She had walked into my clinic with slight limp on the right side. On regional examination of the right knee, it looks puffier, it looks fuller on the suprapatellar pouch, as well as it's warmer to touch. And palpation also reveals that she's tender on the anteromedial quadrant and the lower patellar ligament. I feel that she's able to flex to 90 degrees as she demonstrates actively, and also actively she can extend to full, although feels pain at the end of extension. In my view, I will get her. I've got an X-ray done today, and in that X-ray, it showed the medial compartment osteoarthritis to a moderate degree with some cyst formation and closing of the joint space. My plan is to have an MRI scan if she doesn't get better in 3 months' time, while I'm giving her Brufen 400 milligram twice a day and starting some physiotherapy. So here I can stop. And you remember I spoke deliberately that shut the door. We have programmed in such a way that the prompt will ignore the non-medical conversation and it'll only pick up the medical conversation. So that is a live transcription. Now there's no recording on the system at the moment. This has been transcribed in real time and there's no saving of the recorded file. This is what we've saved. So this is the auto summary. Samantha Willie, 50 years of age, right knee pain, 2 weeks following a stumble in the store, and examination findings. So you have to adjust yourself that when you're examining a patient, you can speak louder so that the system recognizes. Patient walked in with a limp, right knee fullness, suprapatellar pouch, warmer to touch, tendon in the anteromedial quadrant, and lower patellar ligament, active flexion to a degree, etc., etc. Medial compartment osteoarthritis is my diagnosis, and management plan is this. Now, SOAP notes can be the one way to express this transcription, or you can have your own template, like subjective, objective, assessment, and plan. But let's say if you feel that something is missing or something you want to edit, you can go back to transcription and you can edit. For example, I felt there was some spelling mistake, which I can correct. Let me check. Yeah, it should be an anteromedial. So I can correct the spelling mistakes. I can save it. I can go to summary again. If I feel something is missing, I can even record additional comments. I can say that before MRI scan, I will consider an intra-articular injection. So I add that, and then I go back to summary, and then say include the comments and regenerate. So consider intra-articular injection before MRI scan. So that has been updated now. So you can copy it, or you can download it back to your own system in a PDF format, like here. This can go back to the EMR as a record of the consultation. So this is one way of doing it. This one, and of course, transcription, as you said, you can always revisit and change it. There is already, this is the way I did without template. But if you want a template, you can create your own templates, like psychiatric history patient taking, general history patient, medical legal report template, and then you can speak into different sections, and those sections will become headings of your output, like a report, like a structured note. So you can customize this whole system according to your plan. So this is the way, this is my attempt. This is my attempt to solve a problem. The problem that we face in medical legal industry, the problem we face in orthopedics, the problem we face in any specialty clinic, where the admin work is overburdening the doctor, where the doctor is spending more time doing the transcription and the conversion of the information to the system rather than seeing patients. And that is one cause of doctors' burnout. As you know, perhaps that more than half the time of a doctor in hospital practice is spent in documentation and admin work. So that time can be utilized back for the patient. And I want to end this short presentation. By the way, next Wednesday, 1 o'clock UK time, we will do a more elaborate presentation where you will be able to ask me questions, and we can also we can take your questions live and we can respond them in a live way. My motivation to do all this is that we want to get the doctor back to the patient. The real ethos of medical profession is the doctor must be connected to the patient. The doctor is the healer. The doctor is not the transcriber. The doctor is not the record keeper. That is my motivation, and that is what I've attempted to change. I want to help myself first, my colleagues, and then if it works for me, I'm sure there are chances that it'll work for you as well. Thank you, and see you next Wednesday around 1 p.m. UK time. Take care.